Hi everyone, I'm Carilion Clinic's Karen McNew here with Dr. Robert Trestman, who is the chair for Carilion Clinic's Department of Psychiatry and the Department of Psychiatry at the Virginia Tech Carilion School of Medicine, here to have a conversation about some information that we hope you'll find helpful. Our first question that we have for Dr. Trestman is, there's a lot of talk about healthcare workers being on the front lines of a kind of war. Talk about what that means now in the midst of this crisis, Dr. Trestman.
Of course. When we think of a war, we frequently think of battles, and we think of a sense of urgency and life or death crisis. And that is in so many ways what we're grappling with right now. One of our challenges is that those of us in healthcare routinely are dealing with enormous challenges, stressors, for our patients all the time. We're used to that baseline, but now we've added on to that a profound sense of urgency, and we are now awaiting a deluge. Basically, we have been preparing, we've been working really hard to be able to get ready for essentially an enormous battle where we need to be resilient, we need to be on, we need to be able to support each other and patients who are severely ill. So we are mobilizing resources, energy, and time in ways that makes it easy to think about this as being a battle or a war.
Thank you for that perspective. What kinds of long-term challenges can frontline people expect to experience down the road after things calm down? And we hope that's sooner rather than later, but we don't know.
Just as with any situation where we are intensely focused, we're all trying to work together. We have been cutting across all sorts of boundaries, working longer hours, working, for many of us in acute inpatient settings, working under enormous distress and anxiety about our safety and our parents, our children's, our family's safeties. For many of us having to work at home in a more isolated setting, that is going to change. Once the course of the pandemic flows through us, we're going to be having to face essentially what happens after the adrenaline rush. You know, there's going to be a sense of what happens now. Do I go back to the way I was? Do I start doing things differently? Because we don't know what's going to happen after the pandemic, at least the first wave of the pandemic. We don't even know with certainty whether there'll be multiple waves.
What kind of support does Carilion have in place for our employees who are facing mental health challenges related to the COVID-19 situation? Is it just psychiatry and behavioral medicine? Are there other service lines who have gotten involved? I know collaboration is important on many levels for us.
We have worked over the last few weeks to weave together a fabric of all of the different threads already that have existed here at Carilion to support ourselves, both our clinical and non-clinical staff. So we have worked through our employee assistance program to expand that access and capability in a very confidential way that people can call directly there. We have expanded on our what we've called our trust teams for those with second victim experiences, typically after a bad outcome with a patient. But we are now expanding that through the trust team initiatives and have recruited literally scores of people who can function as peer supporters for all of us. We're working with the chaplaincy to integrate the work of the chaplains who historically have supported our patients and their families, so they're now working to support us as well. We're working in an integrated fashion with employee health, so that we're bringing in the resources and making sure that through our own hospital-based health employees, insurance, you know, all of us have access to appropriate care and support. Through our Carilion wellness initiatives and through Virgin Pulse, all of that has been expanded to provide additional completely free access to everyone. We have worked with folks from family and community medicine who had already been developing support for their own folks to expand that into a video conference-based support that we are bringing to each of the high stress areas and groups of people. And so those can be, again, in an anonymous way to support people without fear or anxiety of what's going to happen if I express my concerns. So we are doing everything we can, in addition to working with our marketing and communications teams, to reach out through Inside Carilion, as well as through direct emails, to let people know all of these resources, the fact that they exist, the fact that we know all of us are scared because we are dealing with something we don't know about. So please, if there's one thing you take home from this, it's acknowledge that we all have our limits. We all need to protect both ourselves as well as our families, because if we don't feel safe, it's hard for us to provide a safe environment for treatment and care. So we want to do everything we can so that our staff, our clinicians, our support personnel feel that they have a place to turn to express their anxieties and to get the support they need.
And on that note, what can patients and others in the community do to support healthcare workers at this time? I'm sure some of our employees have people asking, what do you need? And it's hard to answer that question.
Yeah, I think that there are many different things, and certainly through our Office of Planning and Community Outreach, we've been working to coordinate a lot of these efforts. Some of them are much more visible chalk markings, wishing everyone well and support from outpourings to the community. We are working now to develop a range of other things so that folks in the community can contribute financially, so that internally we can purchase the things to provide care for folks. Because of all of the challenges of just transportation and the need for social distancing. We've worked with religious groups so that they can contribute and participate and support. So just feel free, if there are friends and family who want to work in support of Carilion, just to guide them to either our website or to the marketing folks and communication folks who will be able to guide them to make these contributions in a meaningful way.
Wonderful. What would you say to a healthcare worker who is quarantined at home, unable to work, particularly if they've had an exposure? I can only imagine that there are stressful emotions going through that person's mind on multiple levels.
Oh, absolutely. So part of it is to be sure, just reviewing, what is it that you've been told? There may be an exposure. If there are issues of your own pre-existing health care, make sure that you have reached out to be sure through employee health that all of those basics are cared for so that you are as healthy as you can be. Make sure you maintain a structure in your home so that you don't get out of bed. That you need to continue to have a structure so that you get up at the regular time, you eat the way you normally would or better, and you focus on the work that you still can do. You use the opportunities when you have a dedicated time to, for reaching out to family and friends through the different media that we have now. We want to be sure to exercise, particularly aerobic exercise, just walking up and down stairs if you have stairs in your home, stretching. There are wonderful videos that our wellness personnel have now provided for us that are free that you can follow along at home. There are many, many different things that you can do. Certainly if you are asymptomatic and are required to stay at home. If you're symptomatic, take care of yourself. Make sure that you're treating the fever, make sure that you're eating well, that you're adequately hydrating, and to the extent possible, stay physically active. Breathing deeply, going through exercises to make sure you're maintaining your health, because that is what will get us through this.
And I think that you touched on the answer to this next question a little bit, but I want to give you an opportunity to expand. What would you recommend to healthcare workers in particular, in addition to what you would recommend to the community, to reduce stress, isolation, and anxiety?
Well, in addition to what we've just discussed, I think reviewing the reality of the situation. So most of us, as a human reaction, tend to catastrophize. We tend to think about, oh, what will happen? It's going to be horrible. We can only live in the moment, right now. And it's important to capture that sense of strength. And however that works for you, by breathing deeply, by relaxing yourself consciously, by going and using exercises, whether through YouTube, through our wellness initiatives, to relax yourself and to stay focused, and recognize that in general, you will get through this. Most of us will get through this. And when there are specific issues, address them directly. Plan. It's important to have plans in place, because if we have plans in place of what happens when this happens, so spend the time to think through, what will I do if I feel shortness of breath? What will I do if I do have a fever? Who will I call? So if you think that through in advance, you know what to do. If there are others who are with you and are also essentially quarantined with you as family members, rely on them. Develop strategies for coordination and care. Planning, developing a sense of control, and focusing on what you actually do have under your control, which is yourself in this moment. You're going to feel far more at ease, relaxed, and frankly, use this as an opportunity, if you have the time and the energy, to think about, well, what are the things that I've always wanted to do, but I've never had the time for? Well, guess what? You may now have the time for it.
Right.
And if you do, whether it's starting to study a new language online, reading a book, watching that movie that you've always thought about but never could, getting into the crafts that you can do in your home, whatever it might be, use this as an opportunity to enrich your own life.
Some great advice, Dr. Trestman. Is there anything else that you'd like to add to our conversation?
The bottom line for all of us who are in healthcare, take time for yourself. If you've got concerns and anxieties, reach out. Carilion is here for you, and we will provide support for you. Make use of a helpline that is available. Reach out, ask questions. People will be there to support you in ways that will be of meaning to you. Thank you for everything you're doing. We're all in this together. And the wonderful thing about Carilion is we genuinely care about each other. And now, more than ever, that's such an important thing. Thank you.
Thank you, Dr. Trestman. Definitely a great message that Carilion, we are a family, and that if any one of you is needing support, as Dr. Trestman mentioned, we invite you to take advantage and use our Carilion Clinic helpline, and we hope that you are staying well.